The COVID-19 pandemic has changed how each of us interact with the outside world, including healthcare. At Mass General Hospital for Children, we are ready to care for your children, whatever their healthcare needs may be. Our Safe Care commitment ensures we provide the very best and safest possible care for all our patients. Your child's health is our #1 priority, and we have taken unprecedented steps to ensure that our patients and community are safe.
The operating room is a sterile environment because we were concerned about wound infections. The coronavirus has added another step in our cleaning process, however. As our families know, the coronavirus is most frequently transmitted by droplets. For that reason, we go through at least 4 air recycles in the room to make sure that any droplets are removed. Our cleaning team continues to use the same cleaning products that we have used before, which is effective against the coronavirus. Antiseptic prep at the beginning of the procedure is standard, and it is actually effective against the coronavirus. We have added one additional treatment for our operating room environment. At the end of the day, ultraviolet light towers come into the room, and they actually will calculate the area of the room and sterilize it as an additional measure to protect the operating room environment.
Since the pandemic, we have dramatically enhanced our safety procedures, and we're now in the outpatient setting are able to do procedures such as bone marrow tests, lumbar punctures, skin biopsies and other biopsies, and gastrointestinal procedures in a very safe environment. On the inpatient service, we can also do all of these procedures in a safe way, and your children will be in individual rooms to protect them from infection from other possible environmental areas. All procedures, including surgery and chemotherapy and other administrations of infusions, can also be done very safely on the inpatient service. So we welcome you back to Mass General Hospital for Children in a very, very safe and carefully planned environment.
We welcome both parents to accompany your child to the hospital. Both are welcome to stay in the hospital throughout the day, and we can accommodate one parent to sleep over at night at the bedside. All parents and visitors will be screened over the phone for illnesses prior to arriving, like fever, sore throat, or other respiratory illnesses. And we ask that you are symptom-free before coming in, and if you have symptoms, that you deter your visit for a little while. Coming into the hospital, please wear a mask as you come through the main door and up into the unit. We ask that you wash your hands prior to entering the unit, as well as exiting your child's unit. It is a possibility. Physicians and nurses at the hospital will care for all patients in need, just as during any other time like flu season. All clinical staff see patients with all of the necessary protective equipment to maintain safety of both patients and staff, regardless of their illness. Occasionally, there may be a patient of all ages on our units. However, your child will never be placed in a room with an adult. We screen all Mass General employees daily to protect our patients, their families, and our staff. Anyone with symptoms of a possible respiratory illness is not allowed to work until they are better. We want to assure you that we are following strict guidelines put forth by our infection control unit and infectious disease doctors in accordance with the Center of Disease Control guidelines. Parents are screened prior to arrival and must be asymptomatic to stay at a bedside. They are also screened daily and must leave if they have developed any symptoms of illnesses.
We understand your concerns about seeking care at this time, and we want to assure you that everyone at the Mass General Hospital for Children is here for your children and your family. We encourage you to stay in close communication with your child's care team via Patient Gateway or calling the Patient Access Line at 888-644-3248. Do not delay contacting MGHFC for an appointment, particularly if your child has a serious or chronic illness or new problem that requires ongoing care. Our dedicated physicians, nurses, and staff are here to provide your child the very best health care safely and effectively.